Hi, I'm Highnam, and it's a great pleasure to invite you guys to visit the booth here at RSNA on the 101st RSNA. We've recently received a new 510K clearance from the FDA for our Volpara Density Software. The FDA has carefully analysed a lot of data we presented to them about tomosynthesis and mammo, but also about Bio-Rad's 4th and 5th edition. So we are now cleared to give a 4th or 5th edition Bio-Rad's breast density score, along with running on either the mammo or the tomo projections from all the currently FDA cleared systems. Volpara Density has been cleared and matched very well with Bio-Rad's 4th edition for many years, but the 5th edition recently launched actually asks people to assess the volume of dense tissue, which Volpara does automatically, but also it asks radiologists to start judging how well they can actually look at an image and detect cancer even in dense breasts. The key to that really is assessing the volumetric breast density, and Volpara has always looked at clumps of dense tissue and quantified them very accurately, and it's turning out now to match very well with radiologists' assessment of Bio-Rad's breast density. The Bio-Rad's 5th edition, there's a real emphasis now on the sensitivity of mammo and tomo to detection of breast cancer. But also there's a certain mention in there of focal density. It's our belief, and indeed the belief of all our customers, that volumetric measurements really capture the inherent concepts behind focal density. So if you've got a region of very dense tissue, the volume of dense tissue in that area really is caught by Volpara and is used by us to give out the Bio-Rad's 5th edition category. Well, if a radiologist is concerned about an area of the breast which looks dense, with the Volpara density map you can really zoom in and actually start to get some objective quantitative numbers describing that density. The other aspect of density maps is that change over time in breast density is becoming increasingly important, and because we're now showing breast density in its true form and true size, you can start to do comparisons over time. So if you're starting to take certain drugs as chemopreventatives, you can start to see whether those drugs are working by if the density is decreasing. Yeah, Volpara Enterprise has been introduced here at RSNA 2015. It's a unique way of looking at your whole data across your enterprise to ensure your patients are comfortable in their breast cancer screening, they're safe in terms of the radiation dose, but also your whole enterprise is being productive in the number of patients it's actually getting through in a convenient and safe fashion. In particular, the Volpara Enterprise really introduces a lot more patient positioning metrics. So for the first time you can really start to look at how your technologists and machines are performing in terms of patient positioning and therefore quality of image, which is going to seriously affect your cancer detection rate. This is our first tool really for the whole enterprise. It's able to deal with two machines up to 50 machines. And I really do honestly believe it's going to be a very powerful introduction to enhancing quality of mammography across the US and indeed the globe, and this is going to lead to more cancers being detected early.